an interesting presentation. We're going to move straight on to the two discussants, not more than 10 minutes each, and then we'll open up the floor for everyone to participate in the discussion. I'm sorry about the noise in the background. We've decided to work on the road again, which has been going on for some time, but hopefully we can just ignore that. So, Robert, do you want to start? And again, please speak into the microphone.
Thank you very much indeed. Now, I'm trying to fulfill the role as a discussant here, which means I haven't come with a pre-prepared presentation or pre-prepared anything, to be perfectly honest. But the price you're going to have to pay for this now is that I've got to try and weave a script through the notes I've been writing down during those fascinating presentations. And thank you very much to all of you for those really excellent presentations. I think really like to start with sort of mentioning what Gianfranco was talking about, the importance of putting social protection on the agenda, particularly going into this downturn. I think if you look at the last economic downturn, we did quite the opposite. You might say that the policies of structural adjustment were almost like sort of saying, well, we don't want to sort of protect people from the rigours of the market, and the markets, sort of teaches people sort of a bit of self-discipline, and people should be sort of paying for their health and education services, and that's the best way for them to progress. And I don't think any region in the world demonstrates, better how appalling those policies were than Western and Central Africa, where clearly it's resulted in dreadful income poverty and terrible social indicators. If you look at the other MDGs, and I very much like the point that Nicola was making, the importance of tackling the MDGs as perhaps our way into appropriate social protection measures being absolutely vital. So we badly missed that last time, and we didn't protect the poor and vulnerable at all, and women and children in particular going into that last economic downturn, and we need to turn that round now. And I think that we development partners and agencies like UNICEF have got a very big role in making sure that doesn't happen this time. But a couple of presenters mentioned the role of politics. And I think it's extremely important that we sort of speak to political leaders going into this and sort of remind them the importance of not abandoning great swathes of their populations, as much for their own political benefits. That president seeking re-election should be really sort of trying to tap into the views of the population and specifically the poor to ensure their political futures. I suppose we in DFID, and I'm delighted with the way that the presentations have gone and the whole discourse today, very much do see social protection beyond the social assistance of just providing cash transfers. We very much do support cash transfers, and in fact the LEAP programme in Ghana we're supporting, and I think we even financed the South-South link with Brazil. And we've got many examples of cash transfer programmes that we're doing, particularly throughout Africa. But in many respects, we feel that the agenda is much, much bigger than this. And looking at some of the MDGs, that perhaps in many instances, what we should be really looking to try and do is improve access to services and ensure that the poor really reap the benefits of those services, which perversely sometimes can mean actually not trying to target the poor and vulnerable. And very much going for an approach of universal coverage and a rights-based approach so that every single person in the country has a right to access services. And I think we perhaps realise that better in education to start with than we did in health, and the choice of MDG 3 about sort of children being in schools and every child being in school has resulted in much better uptake of education services than maybe health services. Nicola mentioned MDGs 4 and 5. I'm a health advisor and have been particularly involved in this issue of poor and vulnerable people, particularly women and children, being denied access to healthcare. In West Africa, a typical figure for the countries that we've been discussing is that a person visits a health facility on average 0.3 times per year. So that means that a typical person visits a health facility once every 3 years. And with that burden of disease, you can see that there just isn't that access to care. The graph that you put up about money being the big issue, I can tell you that in Sierra Leone it's about 88% of people who were asked why they didn't use a health service when they were sick last time cited money as the main reason. And I think that we, the international community, made a real mess of health financing policy by suggesting the policies of user fees, which have basically acted to exclude the poor and vulnerable, so the services have been captured by the middle classes. So, but thankfully things are changing rapidly there, and I would very much like to congratulate ODI and UNICEF being at the forefront of these changes. The research that you've done in West Africa in highlighting this problem has been used extensively and was very much used in a consensus meeting in New York in February, where a number of advisors came together to really look at this issue of health user fees, and all the big agencies were there. And that meeting basically came up with a proposition that en route to universal coverage of health services, basically, why don't we put women and children first in terms of phasing in universal coverage, and provide free health services at the point of delivery for women and children? Now, some news hot off the press that just yesterday in New York, the United Nations Secretary General launched a new MDG program, specifically looking at the health MDGs, which is advocating this policy, which came out of this UNICEF meeting and very much influenced by ODI and UNICEF. Now, I think this would really be a tremendous step forward, particularly in the health world, because once you start building the entitlements to these services and you start putting pressure on political leaders to deliver them, that can be a very, very effective way of getting poor and vulnerable people in. And if one's worried about, are we really going to reach the poor? What's been noticeable in a number of countries that haven't tried explicitly to target the poor is that when services have become free and universally available, that many of the middle classes have then tended to go to the private sector and sort of the better quality services, and there has been this social safety net and the public subsidy being better targeted at the poor. Now, obviously, we don't want to sort of have a complete two-tier system of rubbish public services and top-quality private services. But in countries like Sri Lanka, where they have got very, very good health outcomes and also very modest health inequality because of this entitlement to free services, it has had a dramatic effect. Nicola mentioned the interesting situation in Ghana. And I think, indeed, in an African context, in a West African context, that is an interesting country when it comes to rights to services. It's interesting that health financing and access to services has become very politicized in Ghana, with both major political parties demonstrating that they're wanting to sort of try and reach the poor now. And I very much think that, as Rebecca said, there's a big role for civil society to get engaged in these debates, to make sure that when new schemes come up, that the poor and vulnerable do genuinely benefit. You mentioned the figure of 45% coverage of the National Health Insurance Scheme at the moment. I think if the truth be known that when the scheme started, the targeting at the poor and vulnerable wasn't particularly good. That the number of poor people exempted was relatively small, and also the scheme wasn't directly providing services for pregnant women. They had to pay a full premium. And as a result, the utilisation of maternity services went down 35% in 2 years. Now, when this was brought to the attention of the president, and civil society was very engaged in these discussions, and he realised that a very poor and vulnerable group was being left out, he very quickly introduced free NHIS membership for every pregnant woman in Ghana, and within 6 months, 433,000 pregnant women had registered for free services. So I think there is a great role for civil society to get involved, as they did in Burundi, where it was being demonstrated that women and children were being imprisoned in hospitals because they couldn't pay their user fees, and sometimes for months on end. So a dreadful human rights abuse there of people coming into the world and being incarcerated in hospitals. But civil society very much getting involved in that, pointing out that was a major problem to the president and resulting in universal access. So I think that there are lots of very exciting things happening around social protection at the moment. We in DFID are committed to make sure that women and children aren't left out, but we very much see, as I say, this as a broad spectrum of policies, and as well as providing cash transfers, a big focus on universal coverage of basic social services, I think, can be as good a strategy as any to try and really sort of benefit the poor and vulnerable.